Our top story, the new restrictions are going to particularly hurt the Twin City community of Albury-Wodonga. The border town already saw jobs lost and lives upended when New South Wales shut itself off from Victoria on July 8. And these new Stage 3 restrictions on Wodonga are a fresh blow to the community. National Senator Bridget McKenzie represents Wodonga and joins us live now. Bridget McKenzie, thank you for your time. What's been your response to these latest restrictions coming in?
Well, obviously, we feel for our Melburnian cousins, wish them all the very best in suppressing COVID-19 through their going to stage 4 lockdowns. But the reality is on the border in my hometown of Albury-Wodonga, but also right throughout border communities up to Mildura, Wentworth, there is a growing sense of frustration that, again, they are being made to pay the cost of mismanagement when it comes to dealing with COVID-19 in our capital city. The reality is we've been dealing with a very strict border lockdown between New South Wales and Victoria that has affected health outcomes, it's affected business owners, it's affected students and our aged and their carers significantly. And we're going to see the economic impact of that for many, many years to come. I was in Wodonga on Saturday, cafes were opening, our restaurants were all up and go, and I guess a lot of our business community was looking forward to moving to stage 2 in the very near future, given that we're a community that has had less than a handful of cases in over 4 months. And then to have this sort of news shutting down those small businesses again, there is a sense of confusion and I guess hurt. But we're all in this together, Annelise. We get that. We'll follow the rules. We'll do the right thing. It's just sometimes I think we wish those in capital cities understood that one-size policy fixes don't work for anyone and have really severe impacts on regional communities.
The argument of the Premier Daniel Andrews has been that they have over 700 cases where they don't know where people acquired it. They have people in the same suburb contracting it and they can't say where they got it from. That's the real issue. And so the concern is it would spread into regional areas before they could get a handle on it. Do you think that's enough of an argument to be implementing the stage 3 lockdowns in rural Victoria that they are?
Look, Annelise, the National Party here in Victoria has been calling for a hard lockdown of Melbourne and affected suburbs for over a month. For over a month, we've been asking for this to happen because we've all got local stories of people leaving Melbourne to get burgers from Wodonga, to pick up puppies in Echuca, people travelling on public transport not actually being asked by authorities why they're travelling out into regions from those hotspot areas, tradies rocking up unannounced to premises on the border from Melbourne and from lockdown communities. So that's been going on for 4 weeks. The reality is the border closure itself hasn't seen, really restricted our communities. Mildura's still got 0 cases. So we've always been calling for Melbourne to be locked down hard to protect our regional Victorian communities, and it's good to see that finally happen. I'm just not as assured that putting all of regional Victoria into a stage 3 lockdown when our communities who've been bushfire affected, who've been coming out of drought and the impacts of the first closure were starting to open up again. There's been 0 community transmission out in our communities. So our argument's always been lock Melbourne down hard where the problem is, deal with those isolated outbreaks strategically, swiftly and securely, and then leave the rest of us to get on with doing business.
And I was just curious to get your thoughts on whether aged care you think is being managed well in your region. This has been the really big issue in Victoria, is just how many aged care homes have had so many cases of coronavirus ripped through so quickly. Do you think enough is being done in your region to ensure that aged care homes are ready for this and that they don't have similar outbreaks?
I think the aged care facilities have been an increasing scrutiny during this COVID outbreak, and there are issues, I think, that need to be addressed with us locally out in regional Victoria, particularly northeast Victoria. Our facilities have a secure workforce in the main, and so aren't probably subject to some of those high risk factors when you are sharing a workforce. And I have not heard of significant issues within the aged care facilities in the northeast of Victoria.
National Senator Bridget McKenzie, unfortunately, we're going to have to leave it there.
Authorised by Bridget McKenzie, National Party of Australia, Wodonga.